Thanks. I just wanted to ask about, can you have long COVID, or symptoms like long COVID, after any other viral illness or cold or flu? And if you do, what should you do?
Do you want to answer that? Do you want me to answer? Yeah, go for it. So I mean, the definition of long COVID or post-COVID is symptoms specifically from having a positive diagnosis, or if there's no positive diagnosis, because not many people are testing now, but if it is similar to COVID, then we would kind of treat the symptoms we're seeing. As far as it coming after other viruses, like one example, Ruth I'm going to go out and live now. So with regards to the taste and smell, so that became popular because of Covid-19, but I'm aware that it's not specific to Covid-19, and there are actually other viruses that have caused loss of taste and smell, but obviously because of social media and everything nowadays, and it's COVID-19 is the latest virus, loss of taste and smell is associated now with that, but it's not specific to that. It has happened on other viruses before. Don't know if there's others.
There are some viruses that are associated with chronic fatigue, so things like Epstein-Barr virus. I don't know if you've ever heard of mono, but that is caused by Epstein-Barr virus, and there is definitely a kind of post-viral fatigue phenomenon which can happen with some viruses. I don't think it's very common after the common respiratory viruses that we've talked about today, apart from COVID. And I think it's also important to say that although long COVID is very serious, and some people with COVID seem to have symptoms for longer, perhaps, than they do with other viruses, the vast majority of people will still get better after they've had COVID. And even if you do have persistent symptoms with COVID after you've had COVID, most of those people will get better. So there is a small proportion of people who develop COVID, a small number of the whole, who are left with symptoms that can go on for a long, long time, and that can be very serious. But in terms of the whole population, that number of people is quite low. I think that's fair to say. Okay. Anybody else got any questions? Thank you.
Hi. I wanted to know if there's any relationship between COVID vaccines and blood clots, like maybe the stroke, MRI, if there's any research. Thank you.
That is a brilliant question. Thank you for asking. So, there is definitely a relationship between COVID, being infected with COVID, and being in hospital with a serious COVID infection and blood clots. So blood clots in your legs, like something called a deep vein thrombosis, or blood clots in your lungs. So we know that if you are in hospital with COVID, then you are at a higher risk than the rest of the people in the hospital for getting a blood clot. The general population, so if you were not in hospital with COVID, we don't think that there is an increased risk of blood clots. In terms of heart attacks and strokes, we don't know, really, I think is the answer. I think because COVID was so common for such a long period of time, we saw a lot of people who were developing heart attacks and strokes at around the same time as they had COVID. And obviously a lot of the people who were in hospital, especially during the first few years of COVID, before we had vaccines, were very, very unwell. And then they may then have gone on to develop more serious complications of a serious infection like a heart attack or a stroke. So that can happen after you've had any infection with a virus or a bacteria. I don't think there's any definite evidence to say that if you've had COVID, you're at higher risk of a heart attack, or if you've had COVID, you're at higher risk of a stroke. But there does seem to be some association. So the two things had certainly happened along the same time, but it's hard to know if one causes the other. Does that make sense? There are a lot of theories about COVID specifically as a virus, and thinking that there might be something particular about the COVID virus that affects the blood and affects clotting. And one of the theories around why people get long COVID is that there are some ideas that it might increase clotting in very, very tiny blood vessels that we can't kind of measure very easily. So that's not like a big blood clot in your lung or in your leg, but it's very, very small blood vessels. But I don't think we know for definite. We're still learning. Does that answer your question? Yeah, brilliant. Does anybody else want to ask anything? Nothing? Yeah. So if nobody else has got any questions, then I think we'll be sticking around for a bit. So if you want to ask anything to myself or to Chris or to the long COVID team at the back, or Dr. Muller's still here, Dr. Carl's here, please come and speak to us. We're very happy to be spoken to. You can take the oxygen probes home. I know there's only 4 of them, so you'll have to divide them up between you. And then obviously we've got the Living Well team here at the back, and also Genes and Health, so please go and speak to them and get your cholesterol checks, and you can have a blood pressure check and speak to Genes and Health if you haven't already. Thank you very much, everyone.